Hi, it's me, Shane. Do you know what is primary immunodeficiency disorders? So, primary immunodeficiency disorders weakens the immune system, allowing infections and medical problems to occur more easily. So, many people with primary immunodeficiency disorders are born missing some of the body's immune defenses, or with the immune system's not working properly, so which leaves them more susceptible to infectious diseases. So far, researchers have identified more than 400 forms of PIDD. Some may go mild but undetected until adulthood, and some are severe that are easily detected after birth. So far, researchers have identified more than 400 forms of PIDD. Some forms may go mild but can go unnoticed until adulthood. Some may go also severe but noticed earlier after birth. So without further ado, let's discuss more about PID.
So for our causes, we have two types of causes. The first one is the primary immunodeficiency disorders, which is caused by hereditary or can be inherited from one or both parents. Problems in the genetic codes that acts as a blueprint for producing the cells of the body cause many of these immune system defects. They can be broadly classified from 6 groups that depends on which immune system is affected. The first one is the B cells or antibody deficiency. The second one is the T cell deficiency. The third one is the combination of the B cell and T cell deficiencies. For our fourth one, it is the defective phagocytes. The fifth one is the complete deficiency, and then for our last one is it is unknown or idiopathic. So for our second type of cause, which is the secondary immunodeficiency disorders, it can be varied from many things, including the radiation or chemotherapy, chronic disease, if you are taking illegal drugs, and lastly, if you have a insufficient nutrition.
Now, you might be wondering, how can you tell if someone has primary immunodeficiency? One of the most common signs is having infections that are more frequent, last longer, or are harder to treat than the infections of a person with a healthy immune system would experience. Some people with this condition even get infections that most people never encounter. We call these opportunistic infections.
But of course, the signs and symptoms can vary depending on the type of primary immunodeficiency and from person to person. Let's go through some of the most common ones. First up, frequent infections are a huge red flag. This could include things like pneumonia, bronchitis, sinus infections, ear infections, meningitis, and skin infections. If these seem like the things you or someone you know is dealing with regularly, it could point to an underlying immune issue.
Next, some people with primary immunodeficiency might also experience inflammation or infection in their internal organs. These can be serious, so it's important to pay attention to things like that. Blood disorders are also common, like low platelet count or anemia. These can lead to issues like fatigue or easy bruising, and they're signs that the immune system might not be doing its job properly. In addition, digestive problems like cramping, nausea, loss of appetite, or diarrhea are other symptoms to look out for.
For kids, primary immunodeficiency can also lead to delayed growth and development. This might include things like slower physical growth or developmental milestones, taking longer to reach than expected. Lastly, many people with primary immunodeficiency also end up developing autoimmune disorders, where the body starts attacking its own tissues. This could include conditions like lupus, rheumatoid arthritis, or even type 1 diabetes.
Kenshin!
Hey everyone, it's me, Jody. Moving on from our diagnostic on how to figure out if you're having a primary immunodeficiency disorder. So we will have a few steps muna. We will take your medical history, history of immune problems, and physical examination to see for any signs of infections and any other health issues. Also, doctors will order a series of tests to confirm your diagnosis. First is the blood test. This will look for specific immune system abnormalities like the low levels of certain proteins or antibodies that fight the infections. Second, the genetic test. To examine your genes or any mutations that could cause your immune system to malfunction. Lastly, the flow cytometry. This involves examining samples of your immune cells using special lasers. This is to identify problems with different type of cells that make up your immune system. That's all. Thank you.
Moving on to the prevention, since primary immunodeficiency is genetic, there is no way to prevent them. However, we can manage them by first, practicing good hand hygiene. Washing your hands with mild soap after using the toilet and before eating can prevent infection. Next is by practicing good oral hygiene. By brushing your teeth every morning and before going to bed, you are significantly removing harmful bacteria and food particles from your mouth, thereby preventing oral infection and maintaining overall oral hygiene. Next is by eating a balanced diet. Eating a balanced and nutritional diet can help prevent infection. Next is by being physically active. By being physically fit, it maintains your overall health. However, before doing these activities, you must consult your doctor for you to know what appropriate activities is appropriate for you.
Lastly, find the vaccinations that you should have. Avoid exposure. Stay away from people who have colds or other infections, or just avoid crowds. Stress management. Studies suggest that stress can hamper your immune system. Keep stress in check by meditation, massage, yoga, biofeedbacks, or hobbies. Find what's best for you.
If you're experiencing any of these symptoms, it is important to see a doctor. So, who specifically should you see? Number 1, your primary care physician. This is your first point of contact. They can assess your symptoms and determine if there are further investigation is needed. Number 2, immunologist. If your doctor suspects you might have PID, they likely refer you to an immunologist. These specialists are experts in diagnosing and treating immune system disorders. Number 3, infectious disease specialist. If you're experiencing frequent or severe infections, an infectious disease specialist can help identify the cause and recommend appropriate treatment.
Thank you for taking the time to learn about the primary immunodeficiency, a condition that may often unnoticed but has profound impact to our lives of those affected. Early recognition of signs and symptoms such as recurrent infections or the prolonged illness is crucial for ensuring proper diagnosis and interventions. Understanding the importance of early interventions and appropriate management can significantly improve the quality of life for individuals with primary immunodeficiency. By educating ourselves and others, we contribute to creating a more informed and supportive community. Let's continue to spread awareness, advocate for timely care, and inspire deeper understanding of conditions like primary immunodeficiency. Through knowledge and compassion, we can truly make difference in the lives of those who need it most.
Next, some people with primary immunodeficiency might also experience inflammation or infection in their internal organs. These can be serious, so it is